Hello, my name is Frank Lodeserto. I am the Critical Care Medicine Fellowship Program Director here at Geisinger Medical Center in Danville, Pennsylvania. I want to give you a brief overview of our program here at Geisinger Medical Center, and I want to thank you for considering Geisinger as your next steps in your fellowship training for critical care. So, first, let me start out with our vision. Our vision is to create a culture of well minded critical care physicians who strive for continuous improvement, demonstrating a passion for teaching, scholarship, leadership, and delivering compassionate care. A few things that really stand out to me in this vision when I created it is one, we want to build a culture, and we have a culture, and we're making a stronger and stronger culture. You may have heard the quote that culture will eat strategy any day for lunch. I love that quote because I think culture is everything. And we at Geisinger believe that having a group of individuals, not just fellows, but our faculty, even our respiratory therapists, nurses, everyone working in the ICU, we want to build a strong culture or a group of people with similar beliefs that are going in the same direction. We want our fellows to be well-minded. We know that there's more to life than just medicine. Um, so that's important for you to also be able to be with your family, give back to the community, and make sure you're doing well. And we do check in, and we'll talk about our wellness initiatives here. And I put in there continuous improvement. I personally, and I think our fellows and our faculty, each and every day always look to get better, ways to improve, ways that we can be better, not just at being physicians, but better teachers, better leaders, better mentors. And we want to be known for our passion. When people meet me, particularly, or meet anyone, any of our faculty or fellows, I want them to say, "Wow, those guys from critical care are really passionate about what they do." And again, in those areas of teaching, we strive to be great medical educators. I put scholarship here, not research, because I believe there's more than just research, and we strive for scholarship, innovative scholarship, which we'll talk about. And that could be from some of the things that I do, from podcasting, free open access medical education, simulation, and also research as well. We think all those aspects are very important. We put the term scholarship instead. I believe we're leaders. I put leadership here. In critical care, in many fields, but critical care, we believe that we are leaders leading the team, whether it's nurses, respiratory therapists, our resident team, medical students. Our patients are critically ill, and our decisions are important each day. We're not always going to make the right decisions or best decisions, but we strive to do that each and every day, and we strive to be leaders. And we'll talk about our professionalism curriculum as well, where we do focus on leadership. And we want to deliver the most compassionate care we can to our patients. So a lot to unpack there in our vision. I'll be a little faster, but I think the vision is so important because it tells you the direction of our program and where we'd want to head in the future. So many of these things I've already talked about. We want to be lifelong students of the art and science of medicine, be innovators in research, but I put a broader category of medical scholarship. We want to be compassionate with our patients, our families, and our colleagues. The next the next goal there is we want to be supportive teammates. We realize that critical care is a team sport where we rely on our consultants and they rely on us, and we help each other out, and we want to be respectful to all our teammates involved. We discuss often the principles of evidence-based medicine on rounds each day, and when we're talking, as well as in our journal clubs. And like I said, we want to be well-rounded individuals that excel in all areas of our lives beyond even medicine. So let's get into some of the program overview. We have 6 closed intensive care units. We have a cardiovascular ICU, which you'll take care of patients with cardiovascular diseases. This can be adaptable up to 30 beds, but for the most part, we have 12 to 16 CV ICU beds. There are 2 large medical ICUs consisting of 14 beds, so a total of 28 beds in total. You'll also round through our neuroscience ICU, which has 18 beds. You'll work with our neurosurgeons, neurologists, and deal with a wide variety of neurologic disorders. We we rotate through the trauma ICU. You work with our trauma ICU docs, as well as a surgical ICU. So I underlined the word multidisciplinary. As you can see, it's not just a medical or cardiovascular ICU. You're going to get exposure to all different ICUs to make you a more well-rounded clinician at the end of this training. So I hope that appeals to you. A little bit about our leadership. This is me. You can't see me, but this is me here. I use my hands quite a bit when I speak. I strive to be passionate about it, what I do. I'm also Italian, so I use my hands a lot. The rest of our leadership team in the top right is Ragad Hussain. Dr. Hussain is our quality safety officer. So she handles our M&M and all things related to quality and safety and QI projects. Next to her is our program administrator or program coordinator. You might hear that term. We use administrative here. This is Aaron Walker, who you've probably dealt with already in terms of setting up your interviews. On the bottom right is Dr. Karen Korzik. Dr. Korzik is our medical director of our ICUs. She also handles many aspects of our fellowship and mentors many of our fellows. And then next to her is Dr. Del Simmons. Dr. Simmons oversees our point-of-care ultrasound curriculum. Now, we don't have an associate program director, but all three of these individuals will handle that role of the associate program director at this time. So everyone wants to know, what is the schedule like at Geisinger? It's important, so let's talk about it and let's get that out of the way because it is a very, very important aspect of your training. So you're going to rotate through all the ICUs. They're all color-coded, and really memorizing the colors is not that important as knowing that you're going to rotate through the variety of ICUs and get a really well-rounded training as you come out of here. But we do a 2-week block system. This is relatively new. It's not new to me in part of my training. I trained as both an adult and a pediatric intensivist. And going back and forth, I did 2-week blocks, and I loved it. And from that point on, I wanted to do something like this in the future. So what your schedule will be is 6 days on and 1 day off. So you'll be on a total of 12 out of 14 days for 2 weeks straight in the ICU. We're not soft or weak, but we believe that 1 month can be long and very difficult. Many of you guys in your residency have done a full month, and it gets quite long, it gets quite difficult. This also mirrors more what faculty do, being 1 week on, 1 week off, especially within critical care. We believe that this will lead to more rest and be more refreshed when you're in the ICU, so you can get more out of it, work harder in that time. We try to limit back-to-back ICU blocks, but that's not always possible. So you will do full month blocks, but we try to limit those. And one of the other things that we thought, or one of the other benefits of that, not just to give you rest, which is important in your training, but it also gives you more time to work on your scholarly work throughout the year. So for instance, you may, in the beginning, not know what you're going to be doing for research. You may be just trying to find a mentor, finding what resources are available to you, what projects you want to work on. So you might not need a full month early on, and that time could be wasted. So giving a 2-week block where you can work on projects throughout your time, we think is a benefit. Clinically, you're going to see it all here at Geisinger, from VV ECMO to VA ECMO to transplant services, to trauma and surgical ICU experiences. You'll see it all. I'm limited, but I think one of the strengths of our program is clinical. If you're coming here and you want to be a great researcher, we have options for research and scholarship, as I mentioned. But I think one of the strengths of our program is the clinical aspects. Everyone who leaves our fellowship always feels very strong clinically. Most of our fellows go on to do work at academic medical centers. Some go on to private practice. And in fact, I say this with pride that anyone who wanted to go into private practice and just do full clinical is fully equipped to do so. I think most of our fellows here want to be in an academic program and teach, which I'm proud of as well. But you're going to leave Geisinger Medical Center, if you choose us for your training, very strong clinically. Electives. There are a number of electives. I've only put a few here, but we are very creative, and if you have an elective that you want to do that, yeah, we have, which we have pretty much everything. We can set that up for you. But scheduled electives are ultrasound and echo. We give you time and schedule to do those. You have an ultrasound curriculum that we follow. We have an online didactics. Um, uh, there's a didactics that you'll talk about that are worked into your curriculum. You have an anesthesia elective. This is also scheduled for you, so you get more time doing airway management as well as intubations. We have a very robust EICU. This EICU works day and night, but your rotation will likely be at night. We've also deployed our EICU during the day to follow up with patients, but this rotation will show you how telemedicine works. We oversee many of our ICUs, smaller ICUs within the Geisinger Health System, and you will get to learn how that works. That might be something in the future plans that you learn about here and are able to do if that's something that you're interested in. But I think having exposure to it is important. We have a critical care outreach service, which is like our triage, which is our triage service, which will be able to show you how to triage patients appropriately at outside hospitals or within the system. This is where the service that will run code blues, also handle consults for patients that may not need to come to the ICU, but really need a skilled ICU doctor to follow up with them while in the hospital. There are palliative care rotations, and like I said, we have others. People have done interventional radiology rotations and many other rotations as well, maybe more ECMO if that's of interest to you as well. So I'll tell you a little bit about our didactics and our education. So this is just a snippet of what our schedule would look like. So on Mondays, not every Monday, but once Monday a week, you'll have high fidelity simulation taught by myself, which I'm passionate and love, and I'll talk a little bit more about that. Every Tuesday, you'll have a 2-hour block of lectures, and I'll talk a little bit more about what's done in that 2-hour block. There are on Thursdays, one Thursday a month, our critical care M&M, which are highly educational. We also have a pulmonary critical care fellowship, which our programs are separate but are very well integrated. So you'll work very closely with our pulmonary critical care fellows. And all the lectures that pulmonary has, separate of critical care, we do all our didactics within critical care together with pulmonary critical care. But all those didactics which are pulmonary are available to you as well. So that schedule goes out, and if something that interests you, you could go to the pulmonary lectures as well. So there's simulation. This is our 2-hour block each Tuesday of critical care. And then, as I said, you can have access to all the pulmonary lectures as well. So the Tuesday didactics, what are covered there? Well, we have ICU board review. We have, of course, any ICU didactic topics that we cover. There are integrated in this professionalism talks, how to give a good lecture, how to interview, things that are important for your professional careers. Journal Club is also integrated within this 2 hours, and we also have ultrasound didactics during that 2-hour block. Other educational activities, you will help facilitate the resident ICU curriculum. We have an online ICU curriculum which we can expose you to because that is free, open access. That was created by us and used by many programs, academic programs throughout the country to educate their residents in the ICU. But you will supervise that. There's simulation training, which I'll talk about. We have airway training, various parts of this airway training. There's a bronchoscopy simulator to get extra bronchoscopies within our GEM Center, which is our simulation lab. As I mentioned, we have a monthly M&M, and there are moonlighting opportunities within the system. This is a great way to gain autonomy and to moonlight within a supervised environment and get paid extra during your training. This is very popular. We try to limit this as well because we want you to be able to get all your requirements done and not get overworked. So this is all optional moonlighting opportunities, but they are educational, and I put it under educational activities. There's also internal medicine grand rounds, and there are some topics that may interest you as a critical care specialist. And not to mention, we have a 100% board pass rate, so we want to keep this going. So simulation, I put this in there because I think it's a unique aspect of what we do here at Geisinger. We have a large sim center. Every month we have our fellows come into the sim center and do high fidelity simulation of various cases. It could be a case of status epilepticus, could be status asthmaticus. So you manage these situations and simulations the way you would any other, and there is a debriefing session at the end. Our fellows seem to really like this. I also do simulation for our residents in med peds and internal medicine. So I'm quite busy in simulation. So if simulation is of an interest to you as well, we can discuss opportunities. Some of our fellows have wanted to learn more about simulation beyond what they do because the programs they were going to needed or were looking for sim specialists. So that could be an aspect where you plan some of your research time or scholarship time and create a curriculum and maybe do some medical education and publications within simulation. So this would be just an idea. This was me with the MedPeds residents, and they're managing a critically ill scenario here. See, they're all hands-on. They're not sitting around, although they are standing around. They are actively resuscitating or seeing how they can better resuscitate this patient. And again, I mentioned scholarship, not necessarily research. Research falls into this scholarship bucket. We have a long-standing electronic health record. We're one of the first here at Geisinger, along with many of our innovations, to adopt the electronic health record. So there's endless possibilities in analyzing data. We have the Henry Hood Research Center, which is located on our main campus, which has a lot of resources for you in your research. Advanced Biostatistics course, which our fellows have gone through. There are many clinical trials going on and ongoing, QI projects as well. So many of our current fellows and attendings hold research grants and multiple projects that you can get plugged in as well. We have an ICU survivorship clinic, which we are one of few in the nation at the time of this, at least at the time of this recording, that have this survivorship clinic, which can also be a very interesting part of your electives or training if you so choose. And I also put free open access medical education as part of your scholarship. Now, you can work with me or anyone else or innovate your own online education as well, however you choose. So there's a lot of things that we do here at Geisinger, and we are open to possibilities for whatever interest you have in scholarship. We have a diverse faculty. Here are some of our faculty members, but you'll find that we have a diverse faculty who is very collegial. We are treated as colleagues here. It's a great relationship that the faculty have with the fellows, and they're usually open door for everyone who wants to come in and choose a mentor. In fact, choose multiple mentors because I think that's important in your career. So that's something we strive to do is diversity, and not just that, but in our teamwork. We have 13 advanced practitioners who you work closely with. We have a very closely knit team in the ICU. Each morning we meet with our physical therapists, case managers, occupational therapists, speech therapists to discuss all the patients in a multidisciplinary fashion on rounds. Our nursing staff are integrated within our rounds as they should be, and we have a great working relationship with our nursing staff each and every day. Our fellows are very tight-knit, close with our nursing staff, which I think is very important in terms of delivering the best care for our patients, as well as our respiratory therapists. We are at the vent discussing, talking about maneuvers, changes. They're great teachers, and we work very closely too in having multidisciplinary rounds with nutritionists as well involved in our rounds, as well as a pharmacist. And very unique about our program, there are 14 different residency programs and fellowships that rotate through the ICU. So if you've come from an internal medicine background, which many of you have, you might just rotate with internal medicine residents or maybe med peds. But here, surgery will rotate with us, anesthesia will rotate with us because they're coming through these multidisciplinary units. So you'll oversee a wide variety of trainees, which is very unique to our program, and also gives you a great perspective and see the differences in the thinking with various training programs. So, this is a great place to train. I stressed that word multidisciplinary earlier. We have a great teamwork dynamics here. And we do believe in wellness. We have wellness initiatives that are integrated within our curriculum. You can see our fellows like to get together. Here's some snapshots over the past years of our fellows working closely together outside of work and having fun. We hope to meet you on the interview. We hope to have you come here for your training and really check us out. We know that this coming year is a challenge and everything is virtual. So please don't hesitate to ask questions about our training program, not just during your interview, but even after. We wish you the very best in your career and in your training, and the best luck in making the right decision for you in the next steps of your training. Thank you very much. Have a great day.